Today's topic about middle ear anatomy. It is better is middle ear cleft, having editus, antrum, attic, eustachian tube, tympanic cavity, and mustard ear cells. You can say the middle ear or tympanic cavity is six-sided box, and highest dimension is epitympanum about 6 mm. So this is middle ear cleft picture you can see. In middle ear is six-sided box. Roof of middle ear is mainly formed by the tegmen tympani extending from tensor tympanic canal up to the editus. So whole length of roof is covered by the tegmen tympani of the tympanic cavity. Floor is thin layer and mainly formed by the jugular wall and sometimes may be deficient, and where it is small canal is there, that is called tympanic canaliculus, which Jacobson's nerve passes through between the internal jugular valve and the ICA, and laterally is covered by the almostly by tympanic membrane and bony outer attic wall, that is called scotum, and erosion of this is sign of cholesteatoma. And posterior wall separate middle ear from the mustard ear cell, editus and fossa incudis, pyramid, vertical facial canal, posterior canaliculus, which the chorda tympanis passes through, is part of posterior canal. Anteriorly, you can see eustachian tube and tensor tympanic canal. And medially is cochlea, anterior oval window. There is hook-like bony projection called processus cochleariformis, tensor tympani tendon, which turns around medially, and it is also mark of the facial canal. Hi guys, this is endoscopic anatomy of the ear. Binocular vision best in microscope, both ends are free. Endoscopic having wide and panoramic view is better visualization. As you can see, the endoscopically middle ear is divided into five parts: epitympanum, protympanum, mesotympanum, retrotympanum, and hypotympanum. These five areas are very important for know each and every structure of the middle ear. Now talk about retrotympanic area. As you know, retrotympanic areas are having many bony crest and sinuses. First bony crest you can see is ponticulus. Its connection between the promontory and pyramidal eminence classified as bridge ridge or incomplete. And there is another crest, that is subiculum, is bony structure arising from posterior pillar of the round window niche toward the styloid eminence. You can see it is just like bridge ridge or incomplete like ponticulus. Funiculus is conjunction of anterior pillar of the round window niche that up to the jugular bulb, classified again as bridge ridge and incomplete. So there is retrotympanic sinus like posterior sinus is triangular area which is limited laterally, posteriorly and superiorly by facial nerve, inferiorly by ponticulus and anteriorly by the stapes footplate and oval window. Sinus tympani round shaped sinus between the ponticulus and subiculum. And sinus subtympanicus is area between the subiculum and funiculus connected with the round window niche anteriorly. So these sinuses, posterior sinus, sinus tympani, and sinus subtympanicus are, you can see in this picture, are important for hidden areas in the cholesteatoma surgery. Like ponticulus variation, it may be barrier, communication, and true bridge. Barrier means completely there is no gap between sinus tympani and posterior sinus. It allow direct in B type, it allow direct communication between sinus tympani and posterior sinus, and true bridge is there. You can pass between the sinus tympani and posterior sinus. Subiculum is also having same variations, like it may be barrier, communication bridge between the sinus tympani and sinus subtympanicus. So these variations are important to know in the middle ear surgery. And sinus tympani may be having three types. It may be shallow, it may be deep, which going to the facial nerve. It may be extend beyond the facial nerve postomedially. So three type of sinus tympani can be seen in the middle ear. So these crest and sinuses are mainly situated in the retro and hypotympanic areas. Now talk about epitympanum. Epitympanum divides entirely by epitympanum and posterior epitympanum by cog. Cog divide anterior and posterior epitympanum. What is cog? Cog is transversely located crest which from the tegment to the malleus or behind the cochleariformis process. It is also called transverse ridge crest and it is located behind the cochleariformis process, which is the fulcrum for the tensor tympani. Process space between the lateral process of malleus inferiorly, pars flaccida laterally, and neck of malleus medially. And laterally, you can see malleolar ligament superiorly also. So these process space are more prone for cholesteatoma, cholesteatoma disease. You can see this process space in the picture. And you can see antitympanic space for the ventilation of the middle ear. There is two isthmus, antiisthmus and postisthmus, which ventilate the epitympanic area, which ventilate the mustard cell through the epitympanic area. You can see this is a middle ear pressure homeostasis or gas exchange. Now talk about protympanum. Protympanum is anterior to the annulus, having canal for tensor tympani, supratubular recess, and eustachian tube. Superiorly, it is having tensor fold. Medially, lateral part of carotid canal, and inferiorly is a protympanniculus. Proteniculum. Proteniculum is the ridge between the hypotympanum and the protympanum. It may be have ridge, bridge, and absent. Hypotympanum is inferior to the annulus up to the jugular bulb. Depth about 5 to 10 mm. Now talk about mesotympanum. Mesotympanum is the middle area which can be easily accessible by microscope or endoscope. You can see it's every like mainly handle of malleus and incus. What is McEwan's triangle? It is having superior supramuscular crest, anteriorly posterior margin of bony external auditory canal, and if you pass a tangent line from the external auditory canal posteriorly, you can see McEwan's triangle for the mustard antrum. You can open the mustard antrum without seeing major structure through this approach. That is McEwan's triangle. So these triangles are very important and basic to know. What is Trotman's triangle? Trotman's triangles having superior petrosal sinus, posteriorly sigmoid sinus, and anteriorly there is a bony angle of all semicircular canals. So these triangles are basic to know for operation in the transmustard approach or middle ear surgery. So this is all about basic of endoscopic anatomy of the middle ear. Thank you so much.